So I'm at the base and a mother has just came in to tell me that her baby is choking. So the environment is safe. We're at the base. I'm the only first responder here, along with the infant and the mother. Mechanism of injury is medical based on what I have been told. Casualty, there's one, the infant. Allied resources, if I need additional help, such as other paramedics or fire, I will call them if the situation becomes complicated. PPE, I got my goggles, gloves, and mask if needed. So now I'm going to introduce myself. Hello, my name is Tyler. I'm a paramedic student. May I help you today? So because the mother came to me asking for help, consent has already been accepted. So now for the events leading up, the mother has advised me the infant is 6 months old and put a penny in their mouth and is now choking. So right away, I'm going to go ahead and rule out C-spine. This is because the infant has been in the mother's care the whole time and there's been no suspected falls or trauma to the infant. So currently, the infant is alert as they are looking at me and they are still conscious. This is a medical. The patient is distressed based on the presentation of the obvious choking, the high squeal from the airway, and the blue around the lips. The complaint is that the infant is choking on a penny. So now on to my primary. So the airway is not patent or protected due to the obvious choking, and the breathing is not adequate due to the high squeal and seeing blue around the lips. So from this presentation, I'm going to stop my primary and go ahead and treat as an FBAO based on what I have been told and what I am seeing. So the treatment for this infant, as they are still conscious, is to deliver repeated cycles of 5 back blows followed by 5 chest compressions until the object is expelled or the infant becomes unresponsive. So I have the baby on my forearm right now, facing me. I'm going to stabilize the head. I'm going to flip the baby over, deliver 5 back blows, 1, 2, 3, 4, 5. Flip the baby over, 5 chest compressions, 1, 2, 3, 4, 5. And I will repeat that until the object gets expelled or the baby becomes unresponsive. Or if the baby becomes unresponsive. So after 20 seconds of doing this, the baby does become unresponsive, and immediately I'm going to start CPR with chest compressions, and I'm going to tier for additional help, such as paramedics and fire for the extra hands. I'm going to perform 30 to 2 compressions. I am the single rescuer, and if help does arrive, I can switch to 15 to 2 compressions. So after each cycle of compressions, I'm going to be looking in the airway to see if the foreign body is visible. In this case, I will be looking for a penny. If I don't see anything, I'm going to try to ventilate, and I'll be assessing for compliance and to see if there is chest rise. During my treatment of the infant, if I do see a foreign body in their way, I'm going to try to remove it, such as a finger sweep, but I'm not going to do a blind finger sweep because it may push the object further down into the pharynx. Also, while treating the infant, if I'm able to do so on my own, or if I have help, I'm going to get suction ready, attach SpO2, set up O2 to the BVM at 15 liters per minute, and get the correct size of OPA. I will continue to perform chest compressions, checking the airway, and attempted breaths until the object is expelled. If the object is expelled, I will reassess ABCs of the infant and perform treatment if needed, and make our way to the hospital as soon as possible. If the breathing is not adequate, after the object is expelled, I will assist with ventilations every 2 to 3 seconds. If the object does not get expelled after rounds of compressions, and there is no compliance with ventilations, then I will also be bringing the infant to the hospital as soon as possible. En route to the hospital, I'm going to be wanting to ask some questions to the mother to learn a little bit more about the baby and see if any information is beneficial for me to know, such as sample questions. So now my patch. So this is truck 7604 en route with a 6-month-old male infant with a FBAO, CTAS 1. There are no abnormal findings or vitals. I performed repeated cycles of 5 back blows followed by 5 chest compressions, but the infant became unresponsive. After 2 rounds of 32 compressions, the foreign body, which was a penny, was expelled and removed from the airway. The patient is now responsive and ABCs are adequate. ETA, 5 minutes.